The streets of Birmingham are overflowing. The once clean and orderly streets have now become a chaotic mess of rubbish and waste. It's a sight that residents never imagined they would see in their city. Black bin bags pile up outside homes and businesses. These bags, once collected regularly, now sit for days, even weeks, waiting for a collection that seems like it may never come. The sheer volume of waste is staggering, and it's only getting worse. The stench of rotting garbage permeates the air. It's a smell that clings to everything, making it impossible to escape. Residents have to keep their windows closed, even on the hottest days, to keep the foul odor at bay. The flies and other pests that are attracted to the garbage only add to the misery. This is not a scene from a dystopian film, but the reality of Birmingham's ongoing bin strike. The strike has brought the city to its knees, with refuse collectors refusing to work until their demands are met. The dispute over pay and working conditions has left the city in a state of disarray. Refuse collectors have downed tools in a dispute over pay and working conditions. They argue that their work is undervalued and underpaid, and they are demanding better wages and safer working conditions. The strike has garnered support from many residents, but it has also caused significant disruption. Weeks have turned into months, and the city is drowning in its own waste. The longer the strike goes on, the more difficult it becomes to manage the growing piles of rubbish. The city council is struggling to find a solution, and residents are growing increasingly frustrated. The sight of overflowing bins is unsettling enough, but the true danger lurks unseen. The accumulation of waste poses serious health risks, with the potential for disease outbreaks and other health issues. The situation is becoming increasingly dire. Amidst the discarded food scraps and household waste, a silent invasion is underway. The piles of rubbish are attracting vermin and other pests, creating a breeding ground for disease. The longer the waste sits, the more dangerous it becomes. Rats, those opportunistic denizens of the dark, are thriving in this environment of unprecedented abundance. They scavenge through the piles of rubbish, spreading disease and creating even more problems for the residents of Birmingham. The city is in desperate need of a solution, but for now, the bin crisis continues to worsen. Rats are highly adaptable creatures, capable of thriving in the most challenging environments. Their resilience and resourcefulness have allowed them to survive and even flourish in urban landscapes. They are drawn to places where food and shelter are readily available, making cities like Birmingham an ideal habitat. The abundance of waste and debris provides them with everything they need to survive and reproduce. The mountains of rubbish accumulating on Birmingham's streets provide both in staggering quantities. These piles of waste are not just unsightly, they are a beacon for rats, offering a constant supply of food and nesting materials. A single overflowing bin can sustain a colony of rats for weeks. The more waste that is left uncollected, the more rats are attracted to the area, leading to a vicious cycle of infestation. These are not just minor inconveniences. The presence of rats in urban areas poses significant health risks to the human population. Their droppings, urine, and saliva can contaminate food and water sources, leading to the spread of diseases. Rats are known carriers of numerous diseases, some of which can be deadly to humans. Leptospirosis, Hantavirus, and salmonellosis are just a few of the illnesses that can be transmitted through contact with rat-contaminated materials. As their numbers explode in Birmingham, so too does the risk of these diseases spreading to the human population. The rapid reproduction rate of rats means that a small infestation can quickly become a major public health crisis if not addressed promptly. Addressing this issue requires a concerted effort from both the community and local authorities. Proper waste management, regular collection of rubbish, and public awareness campaigns are essential in controlling the rat population and reducing the associated health risks. By taking proactive measures, Birmingham can transform from a paradise built on trash to a cleaner, safer environment for all its residents. The fight against rat infestations is not just about cleanliness. It's about protecting public health and ensuring a better quality of life for everyone. Among the many diseases carried by rats, two stand out as particularly dangerous: Leptospirosis and Hantavirus. Leptospirosis, also known as Weil's disease, is a bacterial infection that can cause severe flu-like symptoms, kidney damage, and even death. Hantavirus, a viral infection, attacks the lungs and can lead to a life-threatening respiratory illness. These diseases spread through contact with rat urine, droppings, or saliva. In the current situation, with rubbish overflowing and rats running rampant, The risk of such contact is alarmingly high. The dangers of hantavirus are not merely theoretical. In 2004, Betsy Arakawa, the wife of renowned actor Gene Hackman, tragically died from the disease. She contracted it at their home in Santa Fe, New Mexico, where a rodent infestation had gone unnoticed. This heartbreaking incident serves as a stark reminder that rodent-borne diseases can strike anyone, anywhere. The current situation in Birmingham, with its unchecked rat population, creates an environment ripe for a similar tragedy. Section 5. Expert alarm, the ticking time bomb. Health experts are sounding the alarm, warning that the situation in Birmingham is a ticking time bomb. The city streets are overflowing with garbage due to the ongoing strike by sanitation workers. This has led to a significant public health concern, as the accumulation of waste is attracting rodents and other pests. Dr. Sarah Jones, a leading epidemiologist, warns, the longer this strike continues, the greater the risk of a serious outbreak of a rodent-borne disease. She emphasizes that the unsanitary conditions are a breeding ground for dangerous pathogens. The public needs to be aware of the potential health risks and take necessary precautions. Statistics paint a grim picture. Recent data shows a sharp increase in the number of reported cases of rodent-borne diseases. The numbers are alarming and indicate a growing public health crisis. The city's healthcare system is already under strain, and an outbreak could push it to the brink. According to the Centers for Disease Control and Prevention, cases of leptospirosis have been rising steadily in recent years. This bacterial infection, spread through the urine of infected animals, can cause severe health issues including kidney damage, liver failure, and even death if not treated promptly. Hantavirus, while rarer, has a fatality rate of up to 38%. This virus, transmitted through contact with rodent droppings, urine, or saliva, can lead to severe respiratory issues and is often fatal. The current situation in Birmingham is creating an environment where such diseases could spread rapidly, posing a significant threat to public health. Community members and local organizations are stepping up to mitigate the risks. Volunteers are organizing cleanup drives, and hygiene kits are being distributed to help residents protect themselves. Local government officials are urging the public to stay vigilant and report any signs of disease immediately. Emergency response teams are on high alert, and hospitals are preparing for potential outbreaks. Public health announcements are being circulated on social media to keep the community informed and prepared. The situation is dire, but with collective effort and awareness, the city hopes to avert a major health crisis. Section 6. Vigilance and prevention, your first line of defense. While the situation is serious, there are steps individuals can take to protect themselves. Awareness is key. Be vigilant for signs of rats, such as droppings, gnaw marks, and burrows. Avoid contact with rodents and their waste. Wear gloves and masks when handling rubbish, and wash your hands thoroughly afterwards. If you experience any flu-like symptoms, seek medical attention immediately. Section 7. Demand action, a public health crisis in the making. The responsibility for resolving this crisis lies squarely with the authorities. The bin strike must end, and the city must be cleaned up before a preventable illness becomes a full-blown public health emergency. The health and well-being of Birmingham's citizens are at stake. Write to your local representatives. Demand action. The longer we wait, the greater the risk to ourselves and our loved ones. Section 8. Beyond Birmingham, a national warning. The situation in Birmingham serves as a stark warning to other cities facing similar challenges. As populations grow and resources are stretched, waste management becomes increasingly critical. Neglecting this vital service can have dire consequences. Birmingham's bin crisis is not an isolated incident. It is a symptom of a larger problem, a wake-up call to prioritize public health and invest in sustainable waste management solutions. Section 9. Conclusion. Averting disaster. The overflowing bins of Birmingham are not just an eyesore, but a breeding ground for disease. The threat of a rodent-borne disease outbreak is real and growing with each passing day. We must act now, collectively and decisively, to avert a public health disaster. The time for complacency is over.